Modiga människor.
Modiga människor.
Modiga människor.
Hi and welcome to Modiga människor, Professor Ivановich Krashenюk.
Yes.
Yes, it's important to pronounce the names right.
Glad to see you.
Yeah, and I'm so glad. This is the second time you are in Modiga människor, brave people, and you have so much knowledge, and I am so glad that we can take part of all your wisdom. But we have been preparing several questions already because your was a modersmål. I don't know the word in English, but your original language is Russian. So this is expanding also for you, outside your comfort zone. And that's why I also am very glad that you're doing this. So let's begin, Albert. You have discovered the phenomenon of
Girudobiopsy.
Yeah, biopsy. Thank you. And you are actually the first one to identify the new phenomenon and the rejection of pathologically altered cells during the therapy. And you will explain everything for us. And please tell us about how this can be used for medical purposes.
Hello, Zoya. It's a pleasure to meet you again.
Yeah.
You ask a very correct question, in which you speak of a new phenomenon, the phenomenon of girudobiopsy. This is really a new phenomenon, and why doctors did not know about it before. The fact is that the placement of leeches on the mucous tissues of our body is a rather rare phenomenon. Let us briefly dwell on mucous tissues or membranes. They are called by histologists or cytologists specialists who study the tissues of our body. Let us call them the mucous membrane of the conjunctive of eyes, nose, mouth, genitals, and perianal area, that is the area around the anus. We have worked a lot with inflammation of mucous tissues, for example, the oral cavity with inflammation of the gums or tooth cysts, or with habitual nosebleeds, or with inflammation of the vaginal mucosa. And quite often, after the leeches came off these tissues, we observed the presence of high tissue on a cotton swab, which covers the point of the leech bite, along with a blood clot. We handed over samples of these tissues for analysis to cytologists, and they gave a conclusion. So, in the conclusion, there were always words, signs of damage to specific cells, that is, cells of the mucous tissue, damage of viral or microbial origin. We accumulated these materials, and over time it became clear that this discovery is that under the influence of leeches in the area of affected cells on the mucous tissues by viruses or microbes. The affected cells lose their connection with healthy cells and are ejected along with the blood. Thus, without a special purpose for which I use a biopsy, this is a puncture of tissues with a special needle, with the capture of a piece of tissue, we get a ready-made material for analysis. This material is analyzed by cytologists and the doctor is given a conclusion. I will you give an example, very characteristic. A patient came to me for an appointment who had a problem of gum of inflammation, periodontal disease. When placing caliche on the gum mucosa, at the end of the procedure, a fragment of tissue came off along with the blood. Cytologists found that atypical cells were found in this tissue, and I referred the patient for additional examination to an oncologist. As a result, this patient was found to have a malignant lesion of mucous tissue. This case is very important, and it has led us to examine all such cases carefully. As a result, together with my student Елена Markova, we wrote a book on this topic. Is it clear?
Yeah, fantastic. And I just want to include, Albert, that Alexandra, my friend, I will also put her homepage in this, because she actually helped people here in Sweden with this treatment with the leeches. And I have myself, of course, tried it for, now it's over 2 years, actually. And yeah, you described it. And yeah, it's different, but it's very good. And I have had several leeches on my body, and yeah, it's something I want everybody to at least have the knowledge of how good it is. So,
and that is, you're a very qualified patient.
yeah, I've been there so many times now, and I know how good it is. Yeah.
Okay.
Yeah. Okay, so we take the next question. In the human body, it's in its aquarius system.
Aquatic.
Thank you. Aquatic system.
Aquatic, yes.
Okay. I was actually trying to complex biophysical and biochemical process occur during this girudotherapy, which form the basics for the rejections of pathologically altered cells. Could you please tell us more about this process?
Okay. Zoya, in my scientific work, I had a chance to communicate and even publish the results of joint research with prominent physicists and chemists. One of these scientists was an outstanding chemist who devoted 30 years of his life to the study of the properties of water. This is Professor Валерий Иванович Слесарев. For 12 years, he headed the Department of Chemistry at the Ilya Mechnikov Academy in St. Petersburg. He created the best chemistry textbook for medical students, which was published 7 times. It's a very good result. we published a joint work entitled Medical Reach, a Universal Aqua Radio System, which did not cause understanding among everyone. Professor Slesarev owns the terms aqua system and aqua communication. They contained a very deep scientific meaning. I will touch on the meaning of these terms in my answers. Physical fields are dynamic material environments that transmit the interaction between material objects. However, there is still no clear definition of what physical fields are. If at the end of 20th century, physical fields included electric, magnetic, electromagnetic, and gravitational phenomena, then in the 21st century, electromagnetic, gravitational, strong and weak nuclear phenomena are considered fundamental physical fields. But there is already a reasonable opinion that the nature of gravitational and nuclear fields are similar. Today, science considers mitogenetic, biological, acoustic, vibrational, spinotorsine, vortex, subtle, chemical, informational, energy informational fields, as well as form fields and others. All this is not recognized by science today without any explanation, hoping apparently that everyone knows what physical fields are recognized today. Fortunately, this does not apply to physical radiation, where their nature is fixed in the name. Therefore, we will use the concept physical radiations. Water and its aquatic system don't have a structure, but their age grids have a structure. More precisely, the structure of their nano, micro, and even macro aqua fragments. However, due to high dynamism of age grids, this structure have not yet been separately experimentally recorded. So, water and its solution, as well as biosystem of life based on polar molecules of water, are open. Thermodynamically non-equilibrium, dissipative, polarizable, cooperative, non-linear, supramolecular aqua system with a single extremely polymorphic and structurally dynamic age grid. Therefore, its aqua fragments are multi-oscillatory and can be considered as molecular oscillators. They are sources of coordinated and coherent wave ensembles of acoustic and electromagnetic aqua radiation, that is, AEM, aqua radio radiation. Acoustic emission of aqua radio systems are caused by elastic vibrations of aqua fragments and the layers of age grid of water as a result of thermal and mechanical influences, especially during vortex modes of motion. The acoustic radiation of aqua system arises due to extreme polymorphism and dynamism of their age grids. It can be in a wide frequency range from fractions of hertz to 10 to the 17th degree of hertz and differed in intensity depending on the intensity of external and internal influences. In the normal sound range from 16 hertz to 2 by 10 to the 4th degree of hertz, we hear rustling, murmuring, noise, and rumbling water, which causes us to react differently. Seas and oceans are the working objects of sonar and sonar operators for whom acoustics in a very wide frequency range is a dominant of their activity. Since acoustic radiation is mechanical vibration of the medium, which are also called vibration, in terms, acoustic radiation and vibrational radiation are synonymous. The effectiveness of medical reach is usually explained by its hemotherapeutic effect. However, in 2001, we established that the process of leech blood sucking is accompanied by the emission of radio frequencies in the kilohertz range. Therefore, the therapeutic effect of girudotherapy is provided not only by chemotherapy, but also by physiotherapy of very low power. It became clear why the mucous tissue pathologically altered by viruses and microbes is rejected. Under the influence of the cavitation effect of leech ultrasound, due to the reduced adhesion of the diseased tissue with healthy tissue, the diseased tissue is rejected. This is the nature of phenomenon of girudobiopsy. It's difficult to understand without the knowledge of the acoustic influence of medical leeches. It is impossible to understand.
Yeah, but at least you're trying to let us understand it. So, and I'm very glad for that. And now we have the next question, and that is, can girudotherapy help cleanse the cells and blood from the consequences of the, I'm not saying the word, the vaccine that many people took during the last years? So, can it do that?
Zoya,
Yeah.
I'm waiting the question.
Yeah, that's the question. Can it cleanse the cells and the blood from the consequences from the COVID vaccination?
Okay. You mean, will girudotherapy help cleanse the cells of blood?
Yeah.
Yes.
That's the question.
After vaccination against COVID-19. Yes.
Yeah.
It's very interesting. And my answer, yes, absolutely. But first of all, I want to acquaint you with the results of a very authoritative study published in 2024 in the journal Vaccine. Vaccine 32, 2024. An international team of scientists from the Global Vaccine Data Network conducted a large-scale study analyzing data from 99 million vaccinated people from 8 countries and concluded that some COVID-19 vaccine can significantly increase the risk of complications. According to the results, mRNA vaccines such as Pfizer, BioNTech, and Moderna increase the risk of myocarditis, inflammation of the heart muscle, by 610%. 610%. They also increased the likelihood of developing acute disseminated encephalomyelitis, a severe neurological disease, by 378%. As for the Oxford AstraZeneca vector vaccine, the study found a 32.3% increase in the risk of sinus thrombosis and 248 increase in Guillain-Barré syndrome, an autoimmune lesion of the nervous system. In addition, cases of transverse myelitis have been observed of the administration of this drug and after both types of vaccine, mRNA and vector vaccine, an increased risk of acute disseminated encephalomyelitis has been recorded. In addition, such severe complications from vaccination lead to the accumulation of toxic products in the body of vaccinated person. They can be found both in the circulating blood and in the matrix, I mean intracellular space of the human body. In our studies, the phenomenon of detoxification and the process of girudotherapy was described for the first time, which makes it possible to remove toxins, both endogenous and exogenous origin. Toxins circulating in the blood can cause vomiting or death in attached leeches. It is the definition of Zemstvo doctors for leeches that have passed the stage of blood sucking. This property of attached leeches allows us to consider the behavior after blood sucking as a method for assessing the integral toxicity of the patient's blood. This is author's definition. The accumulation of clinical material on the topic of toxicity of patients' blood made it possible to discover a number of unknown patterns of new facts. For example, if the death of leeches in a patient after blood sucking occurs at 5 to 6 months of treatment, this allows us to conclude that the patient's toxins are in the matrix, intracellular space. The doctor's task is to understand how the toxins got in the human body and accumulated in the matrix and how to remove them. And they could get into the matrix as a result of long-term treatment vaccination or chronic poisoning from the patient's environment, food, air, water, contact during work. If leeches die from the very beginning of treatment, this clearly indicates that the toxins are in the circulating blood. For example, when treated with preparations containing bivalent or ferric iron or other metals, we will observe regurgitation of blood and their death in attached leeches. It should be noted that we will be able to observe the mentioned changes in the behavior of attached leeches only if we don't not kill them, but observe them. As a result of such observation, we receive unique information and answers to the questions. First, does the blood of this patient have toxicity? Second, and if it does, where are the toxins located? Are they in the circulating blood at the moment, or are they in the matrix? And these results are extremely important when planning a pregnancy in the modern woman, especially those living in megacities. If we use this knowledge, we can significantly reduce the risks of giving birth to children diagnosed with neonatal encephalopathy of unknown etiology, not microbial and not viral. In Sweden, there is a specialist who knows how to do this, who has been trained by me. This is Alexandra Theodor. You know it.
Yeah, the best, Alexandra. Yeah, thank you. And the next question is it true that leech's DNA is 50% similar to the human's DNA?
I understand why you are asking such a question. The fact is that it is very difficult to obtain antibodies to the components of leech secretion from leech saliva due to their low immunogenicity. Moreover, I have a patient with such serious disease as brain neurinoma, schwannoma. The duration of their continuous treatment was 24 and a half years. 24 and a half years. According to the state of health and the data of the objective examination of the brain, CT, MRI, without contrast agent and with contrast agent, it can be concluded that she is healthy. This is a public listing in the world medical practice of conservative treatment of the brain with medical leeches, and it was published in 2020. Krashenюk, a title of this article, a clinical case of conservative treatment of brain neurinoma with leeches. And journal, ACTA Scientific Medical Sciences, 4.1 2020, and pages 108 to 110. This is a unique results. There is a case of continuous treatment of juvenile diabetes for 25 years with good clinical results. Both of these cases showed that the components of leech secretion are not capable to sensitizing the patient, even with such prolonged treatment. Scientists from Moscow University have deciphered the complete genome of 3 types of medical leeches and obtained very interesting data of protein coding by these types of leeches. In this study, 189 proteins were identified in Hiruda medicinalis, 86 proteins in Hiruda orientalis, and 344 proteins in Hirudo verbana. This is a good foundation start for the synthesis of drugs useful for human treatment. As for 50% genetic similarity of human genome and the medical age, it's too early to talk about it yet. Zoya, there is a high probability of talking about the antigenic similarity or proximity of leach secretion proteins and human proteins.
Thank you. And the next question, Albert, is it possible to restore damaged DNA after the COVID vaccination with the help of leeches?
Oh, thank you. To some of your questions, I will answer like this. Yes, undoubtedly. To this question of use, I will answer like this. I think it is possible. But the complications after vaccination are more profound. Here, let me refer to the opinion of a well-known specialist in our country, academician Alexander Ginsburg, director of NF Gamaleya National Research Center for Epidemiology and Microbiology in the Russian Ministry of Health. He commented on a study that presented the results of using mRNA vaccines and the impact on the health of vaccinated patients. The study showed that vaccines that protect against the severe disease COVID-19 can provoke a high risk of heart inflammation, blood clots in the brain after immunization, and also increase the risk of Guillain-Barré syndrome, a neurological disorder. Ginsburg explained that the Pfizer and Moderna vaccines created on the mRNA platform are perceived by the body of foreign information. He explained that mRNA, when injected into the human body, is perceived by the evolutionary characteristic of our cells as foreign information, viral, which must be destroyed.
And then we have another question. You are the author of the discovery of the energetic effect of girudotherapy in 1993. And the publication on this topic was the first in world literature. Through Kirlianography.
Yes, Kirlianography.
Yeah.
Yes, Kirlianography.
An increase of growth of the glow area by up to 12% was detected on the human body. Can you please tell us more in detail about this?
Yes. To put it bluntly, the discovery was unexpected for me. And also many people felt a surge of strength during or after the leech treatment session. Serious scientific conclusions cannot be based on subjective feelings today. Also, this is also a method. We were looking for physical methods to provide this effect, and we found such a method. It was the Kirlian method, or Kirlianography, or gas discharge imaging, GDV method. To be fair, it was indeed 1993. At the three conference of the girudoterapists in Russia and the CIS countries, we made our first presentation of the topic, the energy effect of a medical leech. And then he sparked a heated discussion among the audience. Approximately 50% of the audience supported our concept, and 50% expressed the opinion that the result of this experiment are the result of suggestion, that is, suggestion or hypnosis. Objectively, I must say that such a point of view is also acceptable. Our report provided data on the application of Akabane test, thermal puncture test, the international test, which is recommended by the International Union of Acupuncturists for widespread use. This test is the most physiological compared to the fall or Nakatani tests or other modification of electrical tests. All of these tests are used by acupuncturists of different countries of the world to assess the condition of the human channel or meridian system, that is, diagnose human channels or meridians. Kirlian method was attractive for its clarity, and during diagnosis, the doctor received very informative images of fingers and human figures which showed areas of pathology. Complex images of finger glow shapes are called fractals by mathematicians and physicists, and what is very important, in this study we have seen that leeches increase a person's energy potential after the work, which was conferred by increase of the area of fractals and their brightness after exposure of medical leeches. Further research led us to the discovery of phenomena also unknown in leeches, the acoustic or wave effect of leeches on their host. And the owner, as you know, is a person or an animal that can also be leeched if it is ill. The phenomenon was especially pronounced during the COVID-19 post-COVID syndrome pandemic. People with a severe form of the disease were taken to the hospital when a person could not move independently from weakness, could barely lift an arm or leg. And after 4 or 6 treatment sessions with leeches, he was able to get out of bed on his own and serve himself. This is how the energy effect of leech therapy proved itself.
Thank you.
It's possible.
Yeah, it is. And the next question, you discovered the nerve stimulating effect of medical leeches. Please tell us about the dynamics of resonance activation of the brain's neuromediator systems
Yes.
it's so complicated word, during a girudotherapy session.
Zoya, it's a very interesting question. Zoya, the clinical observations and in question date back to the early 19th, when we started treating children with cerebral palsy. Cerebral palsy in our clinic. Initially, the purpose of such therapy was the properties of medical leeches known by the time. After their application, the general condition of patients improves, blood and lymph circulation improves, immunity increases due to the activation of blood phagocytosis, the fundamental reaction of immunity, and an analgesic effect occurs. However, during the long-term treatment of our patients, we noticed a marked decrease in muscle spasticity in such children. It is well known that muscle spasticity is the main symptom leading to impaired function of the musculoskeletal system. As a rule, these children cannot walk on their own, or their gait requires extremely high muscle tension in such children. There are quite a few approaches in the treatment of cerebral palsy, including surgical, orthopedic intervention performed annually in various hospital institutions of the Russian Federation in order to verticalize such patients. Tendon plastic surgery or tendon muscle plastic surgery, surgical removal of contractures manually or using destruction devices. Functional neurosurgery is also used. Selective rhizotomy, selective neurotomy, chronic epidural, neurostimulation of the spinal cord, operation on subcortical structures of the brain. All of the above operation under general anesthesia with questionable results. The motor activity of the operation children does not recover, and the muscle spasticity does not go away. As a result of leech therapy, girudotherapy, using the system treatment method, the OSIS method, our patient's spasticity significantly decreased, which led to the possibility of independent walking. This data has been published. The results we obtained lead us to the search of the nature, cause of such results in the treatment of cerebral palsy. And in 1996, together with Pavlov Institute of Physiology of the Russian Academy of Science in St. Petersburg, we discovered the neurotrophic effect and neuritis stimulating effect of medical leech. It's very important. At this institute, the experiments of Rita Levi-Montalcini from University of Turin, Italy, on the ganglia of a chicken embryo were replicated. In 1986, together with American biochemist Stanley Cohen, they were awarded the Nobel Prize for discovery of nerve growth factor, NGF. In our studies, it was shown that when using aqueous extracts from the head of lyophilized leeches, a clear dose effect of stimulating the growth of nerve fibers in the concentration rate of 50 point, 200 point, and 400 nanograms per milliliter was obtained. The description of this experiment has been published, and a patent has been obtained for the discovery of neurotrophic and neuritis stimulating effect with priority dated March 14, 1996. In 10 years, after Nobel Prize of Levi Rita Montalcini and Stanley Cohen. Later, the group of Professor Baskova from Lomonosov Moscow State University managed to show that 3 peptides from the leech secretion have neuritis stimulating properties. In 1999, it was shown that destabilase has such activity. In 2001, such activity was established for bdelastazine and bdelin B, that is, 3 and 5 years after our priority publications. I will also say a few words about the dynamics of resonant activation of the brain's neurotransmitter system in a girudotherapy session. In 2001, we discovered the leech wave effect. It turned out that, like dolphins, leeches are able to generate low-power ultrasonic during blood sucking. The human brain responds to this signal by changing the activity of almost all neurotransmitters in the brain, including the neurotransmitter serotonin. Neurophysiologists are well aware that this transmitter has a significant effect of human mood. Increasing its activity improves mood, while decreasing it can cause depression. This special property also manifested itself during the pandemic, when we quickly brought coronavirus patients out of depression.
The next question is, please tell us about the discovery of the acoustic effect of leech therapy, and you call it medical leech, a natural aqua radio system.
Zoya, the origins of this discovery should be found in the work of the famous Russian physician, Professor Zakharin, who in 1864 published his famous work, Clinical Lectures of Professor Zakharin. In this work, he described the dramatic story of one of his patients with severe nosebleeds, which could lead to death. The patient lost 1 liter of blood. At that time, he acted as experience dictated in such cases. He used ice to apply to the nose area and applied a remedy to stop the bleeding in the form of a herbal preparation. But this did not lead to success, and the bleeding continued. And then he applied the only remedy that stopped the fatal nosebleed by placing 4 leeches on the mucous membrane of the perianal zone of this woman. The bleeding stopped almost immediately. This work of Professor Zakharin was called brilliant by these contemporaries during his lifetime. But neither contemporary doctors nor doctors of subsequent generation could not explain the mechanism of action for almost 150 years. The idea of the wave effect of girudotherapy arose due to the fact that in the practical application of medical literature, many patients experience difficult to explain effects during girudotherapy session. A feeling of severe chills, movement of various currents through the spine wall, cold or different color streams, sensation, or short time chilling, pulsation, or discomfort in various parts of the body. These feelings arouse into interest and exciting patients and naturally require an explanation from a gyrudotherapist. For the first time, we tried to explain these effects based on a new effect of gyrudotherapy in 1993, suggesting the existence of phenomena of the energetic effect of gyrudotherapy on the human body. In this work, we applied the classical version of Akabane method, the method of thermal acupuncture. In 1995, Moscow researchers Kulikov and Nikonov, using the method of frame technology, confirmed that after sessions of gyrudotherapy, there was a change in the volume of patients' biofield. Unfortunately, reproducing these results is difficult due to pronounced subjective dependence of the results on the properties of the operator, bioenergotherapist. In addition, this approach has been criticized by representatives of classical science. Later, the study of energy influence phenomenon, we applied the method of gas discharge visualization, GDV. Instrumental methods based on the Kirlian effect are currently one of the few that make it possible to assess the condition of the entire organism rather than an individual organ or system. As a result of this approach, it was confirmed that gyrudotherapy has a pronounced AV effect on the patient, with recording the dynamics of changes in the luminous AV GDV grams during gyrudotherapy, provides the doctor with important diagnostic information about the patient's health, including even before the stage of clinical manifestation of the disease. The presence of such effect of gyrudotherapy would make it possible to explain the manifestation of subjective sensation that occur in many patients during gyrudotherapy session. Moreover, to give this sensation a scientific interpretation. The acoustic effect of gyrudotherapy was first experimentally confirmed by us to collaboration with physicists from the Institute of Physics and Technology Academician of Academic Yofa in 2001. These works have been published, and you can get acquainted with them. And then it became clear the paradox of Professor Zakharyan when leeches stop fatal nosebleeds. The wave effect of the leech creates energy conditions in the human aquatic system to trigger the mechanism of blood clotting and the formation of a blood clot in the site of the rupture of the vessel.
Thank you. And Let's go to the next question.
Yes, no.
Please tell us about the discovery of the detoxification effect of leech therapy and how it is related to the new disease IA, the poisoning of the body by medications.
So yeah, this is a very relevant issue and a relevant topic for all countries, especially those with a high technological and the industrial level of development. Recently, on June 5 to 7 this year, the 8th International Conference on Traditional Medicine, Ethnomedicine, and Natural Therapy was held in Rome. It was quite representative, and scientists and practitioners from 21 countries showed their experiments in this field. I managed to become an expert on this classification from Russia, and my opinion was related to your question. Endoecological intoxication of the world's population. Introduction of a new clinical indicator, integral blood test toxicity. In recent decades, the environmental conditions of human habitation have become the subject of close attention of the World Health Organization, WHO. The list of the most common and most dangerous environmental pollutants developed by WHO includes the following substances: acrylonitrile, benzene, carbon disulfide, 1.2 dichloroethane, dichloromethane, formaldehyde, polycyclic aromatic hydrocarbons, 3.4 benzopirin, and many others. But there are other substances in the urban air that pose a risk of developing chronic poisoning, including those that can cause long-term consequences, such as reproductive disorders and the development of malignant tumors. Hygienic rationing is based on the postulate that a concentration of a toxic substance below the maximum permissible concentration is safe for humans. This is also true for one-time impacts. But if the body is exposed to poisons every day, even in small concentration, can it be considered harmless? But if the cause of chronic poisoning is the constant and prolonged use of synthetic drugs that a doctor prescribes for life. Today, the diagnosis of medicinal hepatitis is becoming one of the diseases of modern civilization and a way out of this vicious circle. For the first time, we describe the phenomenon of detoxification in the process of girudotherapy, which allows to removal of toxins, both endogenous and exogenous origin. Toxins circulating in the blood can cause vomiting or death of attachment leeches. The definition of zemstodoxas for leeches that have passed the stage of blood sucking. The property of attachment leeches allows us to consider their behavior after blood sucking as a method for assessing the integral toxicity of a patient's blood, the author's definition. The accumulation of clinical material on the topic of patient blood toxicity has revealed a number of unknown patterns and new facts. For example, if a patient's leeches die after blood sucking on fifth of 6 months of treatment, this allows us to conclude that the patient's toxin are located in the matrix, intracellular space. The doctor's task is to understand how the toxins got in the human body and accumulated in the matrix and how to remove them. And they could get into the matrix as a result of a long-term treatment or with chronic poisoning from the patient's environment, food, air, water, through contact during work. If the leeches die from the very beginning of treatment, this clearly indicates that the toxins are in the circulating blood. For example, when treated with drugs containing iron or other metals, as well as antibiotics, we will observe regurgitation of blood and their death in leeches. It should be noted that we will be able to observe the mentioned changes in the behavior of leeches only if we don't kill them, but observe them. Observing the Ayurvedic rule of ahimsa. As a result of this observation, we receive unique information and answer two questions. First, is the patient's blood toxic? Second, and if it does, where are the toxins located? Where they are in the blood circulating in the moment or in the matrix of patients? And these results are extremely important when planning pregnancy for modern women, especially those living in megacities. If we use this knowledge, we can significantly reduce the risks of having children diagnosed with neonatal encephalopathy of unknown etiology, not microbial or viral. Maybe this answer have repeated one of your answers, but this is a very important for the modern people with high level of industry. The Sweden is also the same country.
Yeah. So let's go to the next question, and that is, please tell us about your discovery of the role of, this is a very hard word, gyrudotherapy in the formation of the
immunomodulatory
effect of the leech therapy.
Yes. Okay, Zoya. A doctor's observation is a very important quality. When our colleagues were passing without noticing made us pay attention. There is always a small subcutaneous hemorrhage at the point of the leech bite. In medicine, there is such a thing as autohemotherapy, that is, treatment with one's own blood. For example, Zemstvo doctors and modern surgeons effectively treat such a purulent disease and furunculosis with the patient's own blood. The patient's blood is taken from a vein and injected into the gluteal muscle of the same patient. As a result, a recovery occurs without cutting the boil with a surgeon's scalpel, and tissue repair occurs without noticeable scar. Autohemotherapy is based on the phagocytosis reaction and its activation. The immune response was discovered by Russian scientist Ilya Mechnikov. And for its discovery in 1908, he was awarded Nobel Prize. So, every time we put leeches on a person's mucous tissue or skin, we observe a small subcutaneous hemorrhage. That means that we activate phagocytosis, a fundamental reaction of cell immunity.
Thank you. And the next question is, are there differences in the use of leeches between the West Europe and the USA and Russia? Alltså, precis, West Europe, precis. And that includes USA and Russia.
Yes, there are such differences, and they are very significant. In Europe and Sweden too, and USA, this method is used mainly in surgical practice when restoring lost limbs. For example, a person's fingers were torn or while working on a lathe. A specialist, a microsurgeon, can connect severed nerves and blood vessels and perform osteosynthesis to connect bones. But in order for the attached fingers to take root again and begin to function, work, you need to apply leeches. There is a known case in America when a dog bit off a child's ear. It was lying on the ground in the dust. Fortunately, the dog did not swallow the ear. The child with an bitten off ear was taken to the hospital, and Dr. Upton sieved on the ear, connecting the nerves and vessels of the bitten off ear to its base on the child's head. But the ear was revived only when Dr. Upton put leeches on this ear and they dissolved the blood clots in the ear, and it began to function again. There is an expression, I became famous the next morning. It's about Dr. Upton from America. But in fact, it was the beginning of a new direction in surgery, the microsurgery. In Russia, this area of surgery is also actively developing, but the method that is considered traditional in Russia is used much more widely. It has been used as a symptomatic method, treatment of symptoms. But since the end of the last century, it has also been used a pathogenetic method. That is, a method aimed at treating the cause of the disease. We are talking about the osseous method of Professor Альберт Иванович Крашенюk, system method of leech treatment. In 1996, the first department of leech therapy in Russia and the world was established in Russia, where doctors and health workers are trained in this method.
Thank you. The next question is very interesting, and it is leech therapy helps to rejuvenate the body, and leeches are also used to improve the condition of the facial skin, including for rejuvenation and facelift.
Okay, Zoya, over 30 years of experiments proves that leech treatment has a rejuvenating effect. In this case, I am referring to the OSIS technology system leech treatment method. In my collection, there are clinical cases of continuous use of the technology for 25 years or more. And we see that these patients have very good working capacity and memory. One of these patients suffers from juvenile diabetes and had to have his foot amputated because he has diagnosed with a diabetic foot with osteomyelitis. He managed to keep his foot, and it's been 25 years, but he walks on his own 2 feet. As for anti-aging facial treatments, it's real to remove wrinkles, and we teach it. Moreover, it is safe, unlike facial skin tinting surgery. In this case, surgical techniques and anesthesia are used, and this does not always go away without complications. But we can use our technology without any complications.
And I just want to add, Professor, that you know that I've been having several leeches.
Yes,
and
yes.
I mean, over 20 leeches in my forehead. And
Yes, the boundary between skin and hair.
Yeah.
Uh,
and you can't see,
yes,
and there is no scars. And this is by far the best example. I had very, very strong wrinkles here. And after this treatment, I mean, it's flat here.
Yes, and after that, you have a very young skin.
Yeah, thank you. And also this is something I noticed, because since early teenage, I've been very black under my eyes, and it's like gone.
Yes, it's necessary to use a small leeches, cosmetic leeches.
Yeah.
Alexandra knows.
Yeah, but I mean, for me, this was not why I started to be a test person, but I'm very glad for that.
Yes, that is, you have an own experience in this field.
Yes, and so that's why I want everybody to know about it, because it has a very good medical effect, but also a facial medical.
And this knowledge is very important for Sweden women.
Yeah,
please underline this idea.
Yeah.
Let us continue, Zoya.
Yeah. And the next question is, could you please tell me about the example of curing several cases?
Yes. Zoya, one of the most difficult cases in my practice is the recovery of a woman from benign brain tumor. This disease is called neurinoma, schwannoma of the brain of the bridge cerebellar angle. When we started this work, and I call this treatment the joint work of a doctor and a patient, this woman had to undergo neurosurgery in 1998. According to the statistic of the Neurosurgical Institute in St. Petersburg, the outcomes of such an operation give the following result. 17% are fatal, and 83% of survivors receive the status of group 1 disabled with disability. She, a pediatrician by profession, refused surgery and tried to find a solution of her problem using alternative medicine, homeopathy, bioresonance therapy. But results were negative because the size of the tumor only increased. That is, this method could not even stabilize or stop the growth of tumor. We started this work, leech treatment, in March 1998. After 7 months of treatment, the first encouraging results were obtained. When we first started treatment, the patient, according to her expression, the right half of her face was wooden, that is, she did not feel pain. The paradox of the situation was that with the clinical improvement, the restoration of pain sensitivity in the right half of the face, the size of tumor continued to increase. The explanation of this situation was that the patient's clinical improvement was that the treatment with leeches reduced the swelling of the tissue around the tumor body. And only after 3 years of treatment came a turning point when the size of tumor began to decrease. The duration of treatment was 24.5 years. 24.5 years. After an objective examination, CT, MRI, and superposition brain scanning, there was a significant decrease in tumor size, and virtually all signs of the disease disappeared. The therapeutic method is based on the effect of the wave acoustic electromagnetic radiation of a medical leech discovered by us. This leads to the thermal destruction of the tumor tissue and hypothermic denaturation of tumor proteins occurred. This clinical case has been published and is the first proven case in the world practice of conservative treatment of brain tumors, nevrinoma, schwannoma, using medical leeches. Крашенюк, clinical case of conservative leech treatment of nevrinoma of the brain, journal, Acta Scientific Medical Science, 2020, 4.1, pages 108 to 110. Everybody can find this article without any problems.
Yeah, that's good. The next question is, are many chronic diseases linked to the contamination of the intercellular space in the body?
Zoya, I have combined the questions 15 and 16.
Yeah.
Please look
Okay,
at.
I will. Okay. So, and you have obtained a patent for the method. So, what do you think? Do we truly understand all the healing properties that nature has endowed the leech with?
Zoya, yes, of course. The technology of the system leech treatment method is protected by RF patent now 27 82 75 25. Priority of the invention dated December 13, 2021 for a method of treatment with medical leeches. If you know Russian language, you can find it. Thus, all our students who have received training at our department have legal protection when using our treatment method? As for the second question, the answer may be as follows. Decoding of the full-size genome of medical leeches has allowed us to establish the following facts. The genome of Hiruda medicinalis encodes 189 proteins, the genome of Hiruda orientalis 86 proteins, and the genome of Hiruda verbana has 344 proteins. I like Hiruda verbana. To date, less than 50 proteins of medicinal leeches have been deciphered and identified. This means that there are many more discoveries ahead of us related to those wonderful creatures, wonderful creatures. Also, we already know about them today. We are delighted with the results of the use for therapeutic and preventive purposes. That's all.
Yeah, that's all.
Yes.
Fantastic.
We have done it.
Yes, we did it.
Yeah.
And it's been a long waiting because you have so many classes, you have so many students. And yeah, and I think that this leech therapy, people, I think everybody has the right to know about how effective it is.
Mhm.
Yeah.
Zoya, thank you very much for your aim in order to give the popular material for the citizens of Sweden.
Yeah.
Because it's a very, your role is very important. Thank you for your efforts, and thank you for this interview for you.
Yeah, and the same to you, really, Albert. I mean, Professor, everything you just gave to us, and all the information and all the knowledge.
Mhm.
So, yeah.
Please tell me about the answers and the reactions of the
Yeah.
people.
I will give people all. Oh, yeah, but I will give you all that,
Okay.
of course, Albert. Now I'm just putting the end in. So be there.
Zoya, thank you very much. See you again.
Yeah. Thank
Regard
you.
my love to Alexandra.
Yeah, I will do that. Okay.
See you.
Bye.